Now, Boris Johnson told scientists that he preferred a Swedish-style approach to the pandemic rather than lockdowns. That's according to evidence given to the COVID inquiry.
Sweden introduced travel restrictions, social distancing and a ban on gatherings, but didn't go into full lockdown, with a Swedish expert supposedly convincing the former Prime Minister that it was the right way forward. Despite this, the UK locked down again in November 2020 and for a third time in January 2021.
Well, joining us to discuss this now is anti-lockdown campaigner James Melville. James, hello, good afternoon. I mean, you must think that now that Boris Johnson should have been listened to. He was the Prime Minister, and yet it seems to me that a lot of these so-called sage scientists were pretty heavy-handed and were running the country instead of elected politicians.
Yeah, they're unelected. Some of those sage scientists, in inverted commas, should have been nowhere near the whisper in the ear of Boris Johnson, who showed his weakness by not sticking to his original guns on this. In the lockdown files showed all of this. I think the government went from a Swedish approach right at the start and then pivoted towards hard lockdowns because of concerted media pressure. And actually what is shown, that it's not a case of almost following the science here, it's following the data. Guess which country showed between 2020 and 2022 the lowest excess deaths in the round of any European country? Yes, it was Sweden, because they held their nerve, they kept their society open, kept their schools open, kept their businesses open. And while initially Sweden were smeared at the start in terms of high death rates on COVID, over time they went down that table. And if you look at excess deaths, they've got the lowest in Europe over that 2-year period. And Britain should have done the same. And the reason they should have done the same is the enormous collateral damages that have been caused by lockdowns, of which we're still paying a price. There's an element of the cost of living crisis that's connected to a cost of lockdown crisis, in particular aspects of inflation and the quantitative easing, combined with things like the mental health problems and also the huge record waiting lists. Lockdowns, I think, was the greatest public health policy disaster in the modern era, possibly ever. And that is because Boris Johnson didn't adopt a Sweden approach. He would have got a lot of criticism at the start if he'd stuck with this, but over time, I suspect Britain's figures in terms of excess deaths per head of population would have been much better than where we are now.
Yeah, and we gather that the star witness this week in this farcical COVID inquiry, which only seems to want to establish whether or not we locked down early enough. It doesn't question whether or not lockdowns work. I've got the answer for them. They didn't.
Yeah, it's dreadful.
It's obvious they didn't work. If you have a lockdown and then you come out of lockdown, and then 2 months later you've got to go back into lockdown, and then you say, oh, that's done it, and you come out of lockdown, and then a month later you have to go back into lockdown. That proves that lockdowns aren't working. It's pretty damned obvious. Now, both Dominic Cummings and then the Prime Minister, for whom he was, of course, the right-hand man at the time, both wanted to adopt the Swedish approach, but were talked out of it, were spooked by Neil Ferguson, the now discredited epidemiologist, who said that 500,000 people would die of this disease, which was an absolute nonsensical prediction based on his silly little models. What actually dictated the course of this COVID crisis in terms of the way we were governed was Neil Ferguson and his models. And if this inquiry is going to achieve anything except for wasting a massive amount of money and paying a lot of lawyers a lot of money they don't deserve, it will be to conclude, if it's going to be worthwhile, to conclude that we must never again turn to people like Neil Ferguson and his little models.
I completely agree. It's turning the outcomes, the potential outcomes of the inquiry on its head. It should be that point that you mentioned, Kevin. Never, ever again. There is not any substantial evidence to suggest that lockdowns worked in terms of reducing the numbers of cases, hospital cases and deaths. But what it did do, and there's a lot of evidence to suggest this, is cause a multitude of damages elsewhere. Not just in terms of the economy, but also in terms of public health and the round. That has to be factored into the conclusion. And if it's not, then serious questions need to be asked why. The impact of lockdowns has been absolutely appalling on so many different levels. There is enough evidence to point that out. And that should be the main focus of the outcomes of this inquiry.
Yeah, I mean, my suspicion is deaths from lockdown will probably far exceed deaths from COVID itself. By the time the inquiry is finished, you know, these things take a good decade and cost billions of pounds. I want to go back to during the pandemic itself. There were a group of scientists, doctors, they called themselves the Barrington Declaration. They all got together, signed a letter saying, please don't do this, don't follow this policy. It is injurious, just like you said, to the nation's economy, to the nation's mental health, to the well-being of children, and will cause an excess amount of deaths when things go back to normal and we realise people haven't been getting diagnostic and treatment services in hospitals. But they were utterly demonised. I mean, you were part of that. You were part of people online who were calling for a different approach to COVID. What was your experience like at the time?
Not much fun. But I've got, like you two, I've got a thick skin, so I got used to it. Initially, the first few weeks, there was a lot of uncertainty about what the right approach should be. This was a new event for everyone. But over time, a lot of things started stacking up on all the things that you've mentioned, from an economic point of view, a public health point of view, mental health point of view, kids' welfare, business, all kinds of things. They showed that there was enormous collateral damages. And there wasn't evidence to show that lockdowns were actually working. Again, we come back to the lightning rod country, that outlier on all of this stuff, and that is Sweden. I remember Sweden at the start. They were seen as this outlier, sort of rogue nation that got it badly wrong. But here we are with the evidence to point out that they've got the lowest excess deaths in Europe because they looked at health in the round. They didn't just prioritise in terms of COVID, they prioritised in terms of public health on all aspects. And at the same time, keeping their schools open, not having a lot of these stupid draconian measures that didn't make any sense whatsoever. I remember the summer of 2020, and some of the measures that were coming in, like the Rule of Six, for instance, were nonsense. They weren't based on science. They were based on sort of nudge theory and sort of behavioural aspects of individuals in SAGE who are far too close to government, putting sort of the whisper in the ear of policies that were never going to work. And again, the lockdown files exposed all of that. The government lost their nerve on this. They ended up pushing a bunch of measures that didn't make any sense and didn't work, but the only thing it did have in terms of outcomes was enormous economic, public health, mental health impact on the country, which will take years to resolve. And one thing that needs to come out of this inquiry, to reiterate, is the finding that this must never, ever happen again. The impact is too great.
James, thank you ever so much.